This is a really cool initiative. What inspired this? Give us a sense of the picture for mental health in New Zealand right now.
Well, yeah, no, this course has been running for a long time now, and seems to be getting busier and busier because mental health is a big factor in our country. A lot of people need help, right? We all have mental health, but some people really struggle with it, and it's really nice to have first aiders who can actually identify their own mental health and work on that, but also maybe help people who have mental health challenges that they know in their workplace or maybe in their community. And it's just doing courses just to get people up to
Yeah.
speed and just kind of making that whole conversation around mental health normal so people are not scared to talk about it. It's pretty important, eh?
Yeah, and it's quite hard because I think if you don't know what to say, you're literally a little bit speechless. When people are struggling and you don't have the right tools and the right words to address what they're sharing with you, you don't really know where to start, right? Because, back in time, often people would say the wrong thing, like, well, just get over it.
Have you tried calming down, Richard?
Yeah, have you tried being happy?
Yeah.
It's like, well, it doesn't work like that, does it?
100%, Kat. Yeah, it's really interesting. We love talking about our own physical health. That's fine. We can talk about things that we have sore stomach or whatever like that. But when it comes to our own mental health, we kind of don't like to talk about it because there's a bit of a stigma, or we're worried about judgment or other people laughing at you or telling you, "Come on, mate, harden up," or we're all depressed, buddy. Come on, keep going. We don't want to hear that, do we? Right? So, in fact, last I looked, 2/3 of all people with a mental health challenge in their lives don't even ask for help in the first place. If you don't ask for help, you're not going to get better, are you? In fact, you're probably going to get worse. So it's just those conversations, right? That connection, that kind of making it normal, making it safe to talk about. A lot of the course is about that. It's good stuff,
And one of the reasons why I love this course is it being described as first aid. If you compare it to, say, the physical, when somebody falls over and skins their knee, we don't panic because we kind of know, all right, well, when this happens, I know what to do. I don't have to be a doctor. I don't have to be able to treat the entire thing, but there's a few little things that I can do. That's the same approach for this course, Richard. So tell me a little bit about some of the substance of this program.
Yeah, well, we teach a lot of stuff. We teach about how you can look after your own mental health, obviously, what things you can do to make sure that your mental health is solid and in the right spot. As I say, we all have mental health, Andrew, right? We're on this continuum. Somewhere along the line with mental health, we're moving up and down, but we always need to make sure we're on the right end of the mental health continuum. So we do a lot of that, and what social support, self-care. We talk a lot about that, but we also talk about how can we help and support and start conversations with other people who are struggling with their mental health, right? So the kind of course is aimed to give you that skill and knowledge so you can recognize and respond to someone experiencing mental distress. Maybe it's workplace or community. It's just we actually give you a framework. Part of the course is giving you a framework that you can apply to help somebody express their mental health challenge and maybe get them on their path to getting better, right? It's a discussion course, and it's about how we can help ourselves, but it's a practical information course too that you can take away with you and go, right, I've got the tools I need now because I know somebody who's got a mental health challenge and I'm ready to engage and suggest some good actions and really get that person, help that person get through their kind of challenge. Because
I really like
what's
the
happening
sound of
here is,
this.
one, we don't want, okay, sorry, we don't want to ask the question, we don't know what to say, and two, the other person doesn't want to say anything to you because they're scared what you're going to say to them.
Yeah.
It's kind of a hard situation, right?
Yeah, it's really important to break down those barriers and make people feel like they can open up. And I feel like society is getting slightly better at this. But I think one thing that people are struggling with is identifying the difference between when someone is having a situational mental health issue and something that's more chronic. What would you say would be one of the key differences between those two situations?
Oh, yeah, absolutely. And we do talk about mental health challenge, non-crisis, and we do talk about mental health challenge crisis. So we have to identify the difference between someone's having a mental health challenge and, they may be irritable, they may not be able to get up, go to work in the morning because they may be feeling depressed. And then we talk about a crisis situation. What does that look like? How do we recognize that? How do you help with that? So you're right. There's kind of, there's different, we have to kind of identify what you're looking at so you have the appropriate help and the appropriate actions and the appropriate conversations to help that person through where they're at.
Nice.
So we go through that in the course. Yeah, absolutely.
So can you tell me a little bit more then about this framework? You mentioned that there's a framework that's provided. Obviously, we can't explain it all to people just in a few minutes on the radio, but what are some things about the framework that you could share with us today?
Yeah, I can totally. We break it down. We have an action plan. It's called the H.E.A.D action plan. Hatuhone St. John have developed this plan, H.E.A.D, HEAD, H.E.A.D, and we go through each letter as we go down, a little acronym, right, for you. And it basically starts off with the first thing you do in any first aid situation, whether it's physical first aid or mental health first aid, is you check your dangers or your hazards. H stands for hazards. Make sure you're safe, right? Make sure other people are safe. And then we move down to engagement. That's the E part of the framework. And that's really important. That's the whole part about how can I talk to this person? How can we have a conversation? How can I make this connection? How am I going to let this person talk to me and not be judged and they feel like they can? How can we start this conversation? So we go through that. The next letter is A, and that stands for action. What are the appropriate actions in this situation? Where's my support? Who can this person go and see? Is it 1737? Is it a counsellor? Is it a co-matua? Is it someone? Is it a psychologist? All these options. Is it my GP? We go through all these options. And lastly, we look at the D part, H-E-A-D. And the D is the debrief. That's okay, well, I went through that. I helped somebody. How's that person? And importantly, how am I now?
Ooh, that's
Where's
great.
my mental health?
Yeah, that's a really good question to ask.
Yeah, so we have at the end of the day, you can walk away with that plan, and it's practical, right?
Yeah, and that's what people need, practical tools to help them in these situations. And I think it'd be great if everyone in New Zealand went on a course like this. So if people would like to enrol, is the website the best place to go?
Yeah, absolutely. Thanks, Kat. It's, what is it, stjohn.org.nz. Look for the training area. And we've got 3 different courses. We've got our kind of foundation course. This is a whole day course. We also have refresher courses you can do, and we also have an online course as well. So it's all on there, stjohn.org.nz.
Hey, thank you so much for joining us as part of the Rhema whānau. We really appreciate your company. And if you'd like to check out more stories like that one, just click here.
In fact, our channel has a whole bunch just like this, stories that can encourage you and inspire you and make you more aware of what other people's lives are like in Aotearoa and around the world. So maybe you could subscribe right here.